All right, so welcome to the Utah Healthcare Registered Apprenticeship Accelerator. I am Madeline Boehm. I work for the Healthcare Career Advancement Program, or HCAP. We are a national organization. We are an industry intermediary for healthcare apprenticeship. Basically, what that means is the U.S. Department of Labor has appointed us to help facilitate healthcare apprenticeships nationally. So basically, our region is the country. I come from northern Montana, where I still live. I work with the Montana Registered Apprenticeship Program for about 5 years, only working in healthcare apprenticeships. So before that, I came from regulation. I was a regulator for healthcare. Healthcare is one of the most regulated industries in the country. In most states, it's the most regulated industry. So it's an interesting mix. So I am glad to be here. I want to introduce our panelists. We have Mandy Glettler. Yeah. Okay. It's close. Yeah. I meant to check with you earlier. Who works for Intermountain Healthcare, and Jason Castillo, who is at the University of Utah with the School of Social Work. He's the Associate Dean. So I'm pleased to have you all here today. And then we have Dr. Laura Dailey on the phone as well. And Laura, I don't know if you can, there she is. And she works for Lifepoint, which is a national healthcare organization. And they have several facilities in Utah, and she'll talk about that. And she used to live in Sandy. Is that correct, Laura?
That's right.
So she has some Utah connections. So as an industry intermediary, HCAP offers support for developing healthcare apprenticeships. We can assist with working with state apprenticeship agencies and the Office of Apprenticeship. We help develop competencies, help find the training component, and we can provide incentive. Which is kind of some of the most important things that we do. We have many different occupations. I'm not going to read through these, but if you have any questions on any of these, I'm happy to discuss those with you. And we also provide a lot of toolkits. We do have a mentorship training program, which I think in healthcare, the training and the mentorship has to be a little different. So I'm excited about that. When I actually worked for the Montana Registered Apprenticeship, I stole from the HCAP's mentor training because I thought it was so good. I am going to introduce Mandy and let her talk about her work at Intermountain.
Thank you. Well, just to give you a bit of a background on apprenticeships at Intermountain, they truly are in their infancy. We started this year. And so we're newbies to the whole process, to the whole game, but we're already seeing some incredible return on investment, not just from a financial standpoint, but also from as well. So we started with clinical engineering apprenticeship in February of this year, February of 2022. And the interesting thing about this apprenticeship is that it was initiated, and I think that might be on the next slide now. I don't know which order, I'm just going with it, but okay, good. I'll get back to this one. Okay. Maybe go ahead too. I think that's a bit of one more. Perfect. Okay. So we started clinical engineering apprenticeship. It's DOL certified to the U.S. Department of Labor. And it's in conjunction with AME. So AME stands for, and I may get this wrong, because
Mandy, can I put you on hold for just a moment?
Absolutely.
They're having trouble with the audio, so let me.
Laura, can you hear us?
I can hear you guys.
Yes. Sorry, guys. Okay, Laura says she can hear you, so we will go ahead.
All right. Go back a slide. I have to follow it too. We'll talk about that a little bit.
Sorry.
There. Oh, one more. Right there. No, let's go one more forward. Sorry, I'm not in order with my slides. This is my fault, but so we started in February 2022 with the clinical engineering apprenticeship at DELO certified to the U.S. Department of Labor. And it in conjunction with AMY standards. So AMY, you can probably all Google it, but I will do my best with that acronym. The Association for the Advancement of Medical Instruments. And what was interesting about this apprenticeship and the reason why it got started was that the director over clinical engineering in the Salt Lake Valley kind of realized one day that 50% of his workforce will be retiring in the next years, and he wasn't having that influx of talent that he was hoping to have or had been having for a number of years. And so he realized we've got a problem here. My workforce is going to be retiring. We don't have anybody. And so he initiated the apprenticeship program in conjunction with AMY and the program that he was doing. And so what's really wonderful is AMY has a DELO certified program. And so when partnering with them, that's all in alignment with the Department of Labor, which is a wonderful thing. So we started off with 3 apprentices in that program this year, with the intent of having 1 to 2 apprentices start every quarter in 2023, so that we have a true rotation in of apprentices and then out of the program and directly into the workforce, so that that can really be a key pipeline. So that program is 2 years in length, so it's a little bit on the longer side for apprenticeship, but that's great because we get the full training and ready those candidates for the workforce. We also have 2 apprenticeships, and you can go back when I'm still on the same slide. It was on before. So
I'm sorry.
No, you're totally fine. We have 2 apprenticeships with intermediaries or talent developers, one being multi-verse and one being apprentice. And so I believe we have a lot of apprentice representation today, and they've been a wonderful partner. But through these 2 intermediaries, we have roles within IT, software engineering, project management, data analytics, and cybersecurity. So I think a lot of people look at healthcare and they may think of these traditional roles like nurses, PAs, all of this, but truly to support our entire city, which is Intermountain Healthcare, we do need all of these roles, and they truly impact the services that we provide at the bedside, and they're truly vital to our operation. So what's really interesting is people do not have to go to traditional places that you would think of, like a big tech company, the healthcare company within these roles. We also have I know this is not Utah based, but in our desert region, which is Nevada, and so it actually now includes southern Utah, we have a medical assistant apprenticeship. This actually got started about a year ago, and it wasn't in a true apprentice model. So what we've done this year to make it fully equitable, we have moved it to an apprentice model. And so what we're also looking to do for 2023 is expand the same type model program using our same community partner in Nevada, and bring that same medical assistant program to both Utah and now our Montana and Colorado states that are now part of our organization. So that's what we have in effect at Intermountain Healthcare. But now I think, Madeline, we can go to slide 1 after the opening. We go back just a little bit and we can talk about these. We'll go back to slide 1. And one more. Yeah, perfect. So when we were looking at apprenticeship for Intermountain Healthcare, we truly wanted to develop our own component and what it would mean to have an Intermountain specific apprenticeship. When doing that and evaluating what we wanted for our organization, we really went to look at other forces that were out there. And Madeline references, working in Montana, They looked to HCAP, they stole from HCAP or borrowed, which is maybe a little bit more of a great word to use for borrowed. So we look to this 110 apprenticeship handbook. We are a 110 coalition member. And so we looked at their handbook and we thought, what components do they already have within their handbook that really are applicable to us? And as we align with registering our apprenticeships, how can we do that from the beginning so that we have our in alignment? So we obviously want to have competitive wages during the training. We want to have structured on-the-job training, field supervision, mentorship, classroom learning, and we always want to provide essentials of their apprenticeship. So you can go to the next slide now. So that really helped us develop some key components for Intermountain apprenticeship. You can go back to slide.
I'm sorry.
Nope, you're going fine. Slide 2. Perfect. Yep. So at Intermountain Healthcare, an Intermountain apprentice is hired from day one into a benefits eligible role. This is truly important for us to provide a very equitable and accessible experience with apprenticeship. What we found from other training programs that we had offered was that we weren't paying from day one. We were asking either employees, current employees, or external candidates to go do their training on their own time. We might pay for that training, but we are still asking them to go do that training on their own time. So what we found was there were some barriers to that. It was really hard to juggle, a home life, going, getting your training, and having a financial income. So some of them had 2, 3, 4 jobs trying to support themselves. And we just felt this was really equitable and also it really allows us to play into the development of that employee coming in. So they're hired into a benefit eligible fund. It also leads to a permanent role within the enterprise upon successful completion of the program. So we want to have that apprentice immediately convert into a role within the organization. They also have a competitive wage that is correlated to the role post apprenticeship, and the apprenticeship wage is competitive and industry. And then all apprentices are for classroom learning and job. Yes.
What does that compensation look like? Is it a stipend or is it part of their hourly wage?
It's their salary. So if our apprentices are hourly, so it's an hourly wage.
So it's like they're going to work except they're going to class.
Yep, absolutely. Yep.
Is benefit eligible mean they're working at least 30 hours a week?
Yeah, we want them full-time benefits eligible because as you know, when you're doing part-time work, those benefits cost a lot more and they're not all right. Yeah. So for us, that's what it meant. We want to provide equity and access, continuous access across the organization. So for us, that was really important to do that. And then just we hit on all those points, I think. So current apprenticeship moving over, and I think our next slide talks about future state. This is what we're intending to do for 2023. We have just received incredible news that within our Nevada region, specifically, we will start a community health worker apprenticeship. We received a grant to do this work. We'll have 40 community health worker apprenticeship slots in 2023, 50 in 2024, and 60 in 2025. The interesting thing about this one is that when the grant was applied for, what they did was they applied in conjunction with some other community health partners. So we will be training the community health worker for Intermountain positions and also for some partners within that Nevada region. We also have clinical apprenticeships proposed for roles like our OR tech or your surge tech, same thing. We just put forth a proposal for 2 vertical apprenticeships. One will be trained through a local educational partner, and one will do their training online through an academic institution online. But those we anticipate starting mid-2023 as well. And then we have an MA apprenticeship program that I talked about that's in our desert region, and we will expand that into our Canyons and Peaks region. One of the things you may have heard in the news over the last year is that Intermountain Healthcare merged with a healthcare company based in Denver or Oregon, Colorado, with operational states as well in Montana. And so we have merged together, and as such, we've kind of reformed into 3 separate regions. So our Canyons region is where we are here in Utah. It includes Idaho as well. And our Peaks region is Montana and Colorado. And so we'll be expanding into those regions with our MA. Okay, next one. Okay, this is just a quick synopsis. We currently have 4 apprenticeship programs in operation. We have 2 apprenticeship programs with 110 talent partner developers, so multiverse and apprentice, 105 apprentices wide, and 17 Utah-based apprentices. We also have 50 apprentices in a program with Multiverse. Those apprentices are all in a remote capacity and live all throughout the country. Although I probably should add them to our Utah-based apprentices because we house them geographically here, so to speak. So their cost center is here in Utah. So we probably have a little bit more to add to that. And next slide. We have some ROIs. Yeah. So this is really incredible. We have 50 apprentices that were hired into a partnership with Multiverse Launching and Intermountain Healthcare in June of this year. They are all remote. We were very fortunate to have a number of them come on site in September. And it was really incredible to have the opportunity. I know everybody struggled with having this remote work and hiring remote workers, and how do we make them feel like we're part of the team? And so this is when we were able to do that for our small group of the larger cohort. And then I think there might be one more slide. We've all heard about, ROI on the apprenticeship model. For us, there's kind of a direct and indirect. Direct, obviously, we're increasing retention and decreasing that turnover, which is a huge cost saving to the organization. We really truly want these apprentices to stay with the organization so that we contribute to that retention and decrease turnover. We also want to be sure we're capturing incredible productivity, we reduce waste, and we are staffing correctly. So those are some of our ROIs that we're already starting to capture. And then indirectly, we kind of know that we're improving morale, we're reducing the need for supervision, we're reducing error, we're increasing efficiency. So that's really important for us and for any healthcare system. Do I have any others? Cover well, thanks. No. Okay, great. Okay, you're done hearing from me for now.
Great, thank you very much. And we will turn it over to Dr. Jason Castillo from the University of Utah.
Thanks, Madeline. And I apologize, the last 2 years have not been kind on the body, so I have more of a gut sitting on me, so I can't talk and sit at the same time. So I apologize about that. And will be standing. Jason Castillo, faculty member in the College of Social Work, currently the interim associate dean for academic affairs. Prior to that, I was the director of our Bachelor's of Social Work program and our Substance Use Disorder Treatment Training Certificate program. So that's really what I'm here to talk about today. So when we look at the state of Utah, there's not an issue with substance use, substance misuse, or abuse, and absolutely not. That is absolutely not correct, right? You'd be surprised at how many groups I speak to, and I don't know if it's between denial or whatnot, where folks just substance use is not an issue. However, we all understand that it absolutely is. So when we look at the state of Utah, substance use is a major issue. In addition to that, it's just a shortage of substance use disorder counselors in the state of Utah. In addition to that, when we look at a number of undergraduate, graduate programs across the state of Utah, when we look at the provision of education, instruction around substance use, there's not a lot of content or material that's being delivered to students around the area of substance use. So one of the things I like to tell my undergraduate, graduate students, because a lot of them come to me and they're like, Jason, I want to, go into the world of, mental health. I want to go into the world of child welfare. And I tell them, it doesn't matter what field you go into, which area, whether it's child welfare, whether it's mental illness, whether it's forensic healthcare. The reality is, as a direct practitioner, as an indirect practitioner, more often than not, you are going to be working with individuals, families, and groups that are experiencing issues related to substance use disorders. So recognizing those 3 items, I'm not saying that the substance use disorder treatment training certificate program or the SUTC program, that's what I'm using right now. That was the culmination. But really what the SUTC program is geared for is to provide the education and training for undergraduate students who are interested in becoming licensed substance use disorder counselors or licensed advanced substance use disorder counselors in the state of Utah. So again, we've got our issues, we've got our goals, and I got to tell you, just with the shortage of SUTCs and ASUTCs across the state, is counties, localities, nonprofit organizations, for-profit organizations coming to the University of Utah and college of social work and saying, hey, where is this future workforce? And so one of the things that I've been sharing with our colleagues out in the field, and they're working with Melissa and then also Pat Miller with the Department of Labor is the SUTC program. So the SUTC program has been around since 1982. In that time, we've trained thousands of students to be SUTCs and ASUTCs. Prior to 2011, a person with a high school diploma or a GED could be licensed as a SUTC. Right? In 2011, the Utah State Legislature changed the system where somebody must be working towards their associate's or their bachelor's degree and working toward the SUTC or an ASUTC. Okay? And so if you can go on to the next, please. And so again, this is the mission again, issue and problem shortage of substance use disorder counselors, the need for trained person. Right here, one of the big partners for the SUTC program has been the U.S. Department of Health, notably the Health Resources Services and Administration, HRSA for short. In around 2011, there was a notice of funding opportunity for nonprofits, public, and institutions of higher education. Recognizing that there was a shortage of the workforce, funding made available to institutions to provide education and training again to those who were interested in becoming a substance use disorder counselor. So in 2017, the SUTC program was one of 20 programs across the United States that received funding to make education and training available to students. I'll talk a little bit more about that grant and then also the results that we've had from that. So between 2017, 2021, we graduated something like 136 students, right? In the year 2020, we applied for and were awarded with another federal grant through the HRSA as well. And this is where, when we talk around apprenticeships. So we are new to the world of apprenticeship, and I know that it's been a learning curve for us. I can't tell you how many times at graduation, students will walk across the stage, while you're in your degree, shaking hands and like, Jason, I'm not ready. And I'm like, yeah, I know you're not ready. But that's where most graduates, are in their degree. So part of this, when we look at the education and training of our students, we are looking at didactic instruction, learning that happens in the classroom. In addition to that is that field piece. And so when we look at our students, there is a field practice component that students are required to complete anywhere from 200 to 350 hours, regarding whether you're a SUTC student or an ASUTC student. I don't know about you, 200 to 350 hours of real world experience, just not enough time. So when this opportunity came available to us, and with the opportunity for our partners, our community-based partners, along with this apprenticeship site, I mean, we already had the vehicle, which was the instruction and the training. This apprenticeship piece was new for all of us. But I've got to tell you that we've got something like 112 field practice placement sites. Of those field practice placement sites, they are all on board. The majority of them are on board as far as serving as apprenticeship sites. So if you go on to the next slide, please. So when we look at really our program and our apprenticeship program, it really is one through our federal grant. Our federal grant does require that we have 2 levels of training. The 2 levels of training are really business as usual, what we've done really since 1982, which is a combination of didactic training and field training. So right there, that's the level 1 training. And in the next slide, we'll talk a little bit more about the curriculum of the program. Upon the completion of the level 1 training, students receive a certificate The brand new piece is this right here, the level 2 training as far as the apprenticeship. So as I told you, the field practice placement, 200 to 350 hours. When we look at the apprenticeship, this is a 2,000 hour apprenticeship. One of the things that I want you to keep in mind with this apprenticeship is the Department of Labor, they do allow students to utilize the hours for the didactic training and their field training towards these 2,000 hours. So when we look at that, and if my math is right, we're really looking at about 1,300 hour apprenticeship for students in the SUDC program. So when we look at level 1 training, we're really talking students have the opportunity to take this as a non-credit, non-matriculated student, right? And I gotta know that it's much less expensive that way, right? When we look at students taking it as a matriculated student for credit, right? So again, 2 options that they can take. In addition to that, students have the option of 2 tracks. And so if we look here on the left side, the SUDC track, which is really a combination of, I believe it's 6 courses, and then also a field training component and a seminar component. When we look at the advanced SUDC or the ASUDC on the right side, you're looking at 2 more counseling classes, an advanced professional development, a seminar, and then also a field practice placement as well. So here we've got a 200-hour field practice placement. Here we've got a 350-hour field practice placement. Again, 2 tracks, SUDC, ASUDC, take it as non-credit or credit student. And yeah, this is the curriculum. So when we look at a SUDC counselor, if you go to the next slide, Madeline. So when you look at, scope of practice, it's like, Jason, this is great, as far as, the education and training, what can I do with this? When we look at a SUDC counselor, we're really looking at somebody that can indeed go out into the field, that they can engage with their clientele, that they can conduct screening, intake, that they can write up an assessment, that they can help in the writing of the treatment plan, that they can lead and facilitate individual family group sessions, that they can attend to case management, documentation, referral. When we talk about, interprofessional education, interprofessional development, also work with other persons. So as I said before, a population that it doesn't operate in a vacuum. Oftentimes clientele are being served by multiple systems and organizations. So how to work with other professionals. So can you go back to the previous slide, Madeline? And so when we look at the curriculum in and of itself is providing students with the opportunity to acquire the knowledge and skill that they can indeed go and operate and practice as a SUDC, ASUDC. So when we talk about ethics, when we talk about competency, when we talk about professional practice, when we look at counseling, as far as with individual families, counseling, leading, facilitating groups, when we talk about cognitive behavioral therapy, motivational interviewing, dialectical behavioral therapy. These are all things that SUDCs and ASUDCs can do in their practice. Right? These are things that executive directors are saying, hey, I need more folks that are able to go out into the field and do these things. So while counseling and psychotherapy, individual one-on-one is ideal and it's beneficial. One of the things that's happening is like, hey, I don't have folks that are able to do intake screening assessment. Or I do, but I can't get clientele in for about 3 weeks to a month. And I got to tell you that we just don't have that amount of time to have our clientele, wait for services. And so when we look again, the curriculum, preparing students to, you go to the next slide, Madeline, is to do these things, right? Go into an agency organization, I'll put you back in here, complete this. Upon successful completion of the program, then apply for the national examination. Upon successful completion of the national examination, then go into employment. And this is where one of the things that we've done with our community-based partners is there is this pathway. Certainly when we look at pathways of education and development, one of the models that we've created is students will go and do their 200, 350-hour field practice and placement. What students and what field instructors have communicated to us is, can we have our student that did their field practice, can we have them continue as an apprenticeship in their site. So that's one of the models that we're planning on doing. One of the other things we're actually planning, I'll talk to you in a little bit. The other one is, I really want an opportunity. I did my subsea field practice placement, say with Utah Department of Correction. I really would like to go to a nonprofit organization and do, my apprenticeship in those hours. So really one of the things that we try to create is really flexibility for our students in order to have the apprenticeship experience that they believe will be most meaningful and beneficial to them. Can we go to the next slide now? Okay, so this is just a contact information for all of us who are working on the project team. I'm the principal investigator of the grant. So any questions that you have, feel free to send any questions to me. And
I apologize, I'm not familiar with this profession, but is a degree required for it?
a person must be working towards their associate's or bachelor's degree.
So if they are non-matriculated when they take these classes, they're not contributing to their degree seeking part of the program.
They are not, if they take it for non-credit. So again, you can take it for credit or for non-credit.
And if they already have a bachelor's degree in something else, they're fine.
They're so good. Yeah, just as long as we all understand that it is through the University of Utah, it is an undergraduate certificate. And I gotta tell you that even again, when I looked at our curriculum for our MSW program around our substance use area of focus, really three courses. So, and two of them are on accounting, and one is around neurochemistry, pharmacology, that we're getting more, students are getting more didactic instruction, field practice experience in an undergraduate certificate program than they are in a graduate degree program, in my opinion. So, one of the things I do want to communicate is when we look at the number of students that have graduated, we've just seen a growth. When we look at the number of students that have successfully passed their national examination, we're seeing a growth there. When we see the number of students of our graduates that are getting licensed, that are getting their, don't ask me what the NPI stands for, National Practitioner or something, index or something, that they're also achieving that number as well. But more than that is that they are in a place of employment in the behavioral health field as an ASUDC or as a SUDC. In addition to that, the number of students or graduates with their bachelor's degree, of the 130 some students that we graduated, 50 some went on to get their master's, their graduate degree. So when we look at pathways to education, this is what Melissa was speaking about earlier. Apprenticeship is really an opportunity to get your foot in the door. It is an opportunity to give you the real world lived experience while accumulating hours, while working on your licensed hours, and then also preparing you should you go on to other areas of advancement within the industry or graduate school and administration. So, Madeline, I'll leave the PowerPoint. You got the PowerPoint?
I do, and I can
Can certainly make it available to everyone.
figure out how to make that available for you all. Thank you very
All right,
much,
thank
Jason.
you.
I'm really excited about the expansion of healthcare apprenticeship into behavioral health. I think that's just a key area. As I said before, I'm from Montana. If you cut Montana in half, the eastern side of our state has one psychiatrist.
Holy cow. Are you serious?
Yeah. So we really need to start working on developing these other roles in behavioral health. And that's one reason I was so excited to hear about what Jason's doing down here. So thank you. I'm going to turn this over to Laura, Dr. Laura Dailey, who is online. And Laura, are you ready to take it?
I am ready to take it. Can you hear me?
Yes.
Wonderful. So thank you guys for having me and taking the time to pay attention to healthcare apprenticeship. It is exciting, and I think it's neat to see the previous two presenters because they have similar programs but different, and they all kind of follow, I guess, a similar, framework of connecting folks to career advancement opportunities, and that's certainly where ours kind of started. So that's just my contact information. And if you want to go to the next slide, we kind of I'll kind of get into it a little bit more about, Lifepoint's careers and Lifepoint's opportunities. So I wanted to give a quick snapshot of Lifepoint because this is kind of a newer organization for us. This was previously Kindred Healthcare, and we were acquired by Lifepoint, I guess almost a year ago. And so we're starting now to expand and offer apprenticeships in the Lifepoint Health hospitals across the country. But we've had registered apprenticeship programs in our rehabilitation hospitals since June of 2020. So the opportunities are, the sky is the limit for us as far as creating opportunities for employees, current employees. Our programs are a little bit different because they are, we think of them as advanced knowledge and advanced skill programs. We have built our programs to specifically educate our current employees on the type of care that we provide in our hospital settings because they're unique. You can see here that, we have a large network of hospitals. A lot of the Lifepoint hospitals are in rural communities under the mission of making communities healthier. So we're connecting to local, rural and urban communities across the country. We're in almost every state with over 50,000 employees. Right now we have 63 community hospital campuses. Those are acute care hospitals, emergency centers, labor and delivery, surgery, OR, as well as outpatient clinics, rehab clinics. We have 30 rehab and behavioral health hospitals. That number is growing across the country, and 170 additional sites that include managed acute rehab units, outpatient centers, and post-acute care facilities. So it's a large healthcare organization. That means that there's a lot of infrastructure and manpower to support apprentices learning all along the way. So if you want to go to the next slide to kind of get into what that looks like for us or has looked like for us. So this is just a bit about our history. So we launched our rehab nurse assistant apprentice program in June of 2020. And this program and all of the programs that you see listed on this slide are, like I said, they're advanced skills. So we take folks that may have been working as a nurse assistant for any number of years, but typically we know that nurse assistants come out of the CNA program and go into assisted living facilities or living or things of that nature, nursing homes, and not necessarily into a rehabilitation hospital, and didn't even really know that rehabilitation hospitals existed or that that was a career pathway that they could look to pursue. And so our program really gives advanced skills and knowledge on what it is to work as a nurse assistant in a rehabilitation hospital. All of our curriculum was built by our clinical leaders. We have education programs in our hospitals across the country that are in existence that we use to educate current employees and staff members on just up and coming trends or new processes or techniques that they could consider. And so we relied on our clinical leaders to really build the curriculum that takes it a step above what someone would experience in a certified nursing assistant program or even a patient care tech program. We know that every state is different in what they require. Some don't even require that they have their certification or go through a patient care tech program. And so in those states, it's really important to have some kind of education to help that individual as they transition into their role as a nurse assistant in a setting that they may never have experienced before. So since June of 2020, we have expanded and now have apprentice programs for LPN, LVNs. We have a rehabilitation RN residency program. That program is specific to prepare RNs to sit for the CRRN exam, which is the Certified Rehabilitation Registered Nurse that is administered from the Association of Rehab Nursing, ARN, which is a national association that we're members of, and the curriculum is provided by ARN. It also has both of those, the LPN, LVN, and Rehab RN residency programs have monthly seminars that the apprentices and the residents attend. They either attend live or view a recording of afterwards. And presenters are clinical leaders from our own hospital system. They have their CRRN and can talk to not just how to prepare for the exam, but how to apply the knowledge that they're learning in preparation for the exam to their current patient population. So that's kind of a regular monthly engagement with those apprentices. We have a cook apprentice program that has some content that we created particular to working in a hospital. So we have patients, we have a dysphagia diet pathway for the apprentices to complete that talks to them about considerations when they are preparing food for patients with that particular diagnosis, and just other therapy kind of considerations that are important, because all of these again are in our rehab hospitals currently. We're building them and expanding them to include our additional sites of service now that we're part of the Lifepoint Health family, but they have been for our rehab hospitals. And the Cook program is one where we have an external academic partner that the apprentices work through. It's an online program, but they have in-person teach back and physical practices that they have to complete with their on-site culinary service manager. They take pictures of meals that they've prepared. They have projects where they prepare meals or prepare desserts or some kind of a unique buffet for the administration in the hospital so that they can experience the kitchen, and for patients as well to do special days. Those are kind of activities that are opportunities for the cook apprentices to showcase their learning and knowledge and really enhance and create a fun environment for the hospital through events that the cook staff puts together. And as a part of going through the culinary program, the apprentices can receive undergraduate college credits. And if we have managers that go through the program, and some of our managers have their CDM, and if they have their CDM, they can get 74 continuing education units for completing the culinary program. And then we have our environmental services program. And this program is for all of our EVS staff, frontline workers, everybody who joins with us joins that program. So all new hires are brought into that program. It's an amazing way to streamline the onboarding education experience for individuals, because they may be coming, as all of the programs, they may be coming from an environment before that was not healthcare. And it's really specific to know about things that are special considerations for EVS staff, especially now with COVID. This program launched during COVID, and we worked hand in hand and continue to work hand in hand with our infection prevention and control nursing staff to make sure that our EVS folks are following current protocols as they change every day. And the EVS staff goes through curriculum that's free and administered from the CDC and APIC, which is the Association for Professionals in Infection Prevention and Control. That is a national association that has education for RNs and EVS staff and others, physicians, all the like. So you kind of choose your occupation that you want to focus on, and EVS has particular information for working in healthcare and hospital settings. And that is supported by curriculum that we again developed in-house that pays specific attention to our hospital settings. So we give them that advanced knowledge on how to care, how to do their jobs and perform them to the best of their ability in our specific settings. So those are our current programs. And since June of 2020, we now have enrolled and in various levels of graduation or currently working on their program, 800 apprentices. It's been an amazing, huge success for us. I think in a couple of slides later, I'll show examples of what those successes are. But in a big, quick snapshot, all of the programs are 1 year in length. And all of them have online modules that are through our learning management system. And that's the way that we track apprentice completion. That's the way the hospitals measure and track when an apprentice has completed certain things, because all programs have milestone pay increases for completing tiers of the educational program along the way. They also have in-person physical practices, and those are monitored and measured, and the engagement and the how well the apprentice is understanding the material is then monitored in-house, in person by their manager and in some cases an apprentice team lead, which we call our journey workers. So those are the folks that support as a peer the apprentices coming in different occupations, and we have training that they go through in order to be able to be an apprentice team lead, so they understand what the apprentice program is and entails. In many cases, they go through the apprentice program themselves. They also have a culminating capstone project. The capstone projects are just amazing. I have some pictures of some that we've completed later on in the presentation, but there are ways for the apprentices to kind of give back to the hospital. They're presented during team huddles or posters that are created and put up in the hospital for all to see in shared break rooms, articles that are read and then summarized and disseminated to not only the folks in their hospital, but division-wide. We have newsletters that are published to the entire company, the entire organization, to share information and knowledge and the good work of all of the apprentices in hospitals, and those capstone projects are shared in that way. And then we have live monthly seminars. The monthly seminars have really been, that's kind of been it was a surprise to see how amazing and well received they are, because we know how busy everybody is in the hospital, and you never know what's going to come up in the day, if you're going to be able to get away for a half an hour seminar or not. That's why we record all of them, so that the apprentices can view a recording afterwards. They're required to attend each month's seminar or view a recording, and they're really engaging. That's where we see a lot of information sharing. How do you do it in Iowa? How do you do it in Montana? This is how we do it here. There's a lot of that kind of information exchange going back and forth. That's just organic. That's come out of the engagement that we have seen from the apprentices and from their supervisors in the program. So that's a quick look at kind of currently what we have and what the experiences are like. All of these programs are managed by our department. So myself, and I'm on a team with two others that kind of oversee the all of the programs, make sure that everybody is registering, and make sure that everybody is staying engaged and working through them. We have grant funding that supports each of the programs. And so we maintain data and disseminate that as needed to folks like HCAP and Madeline and other industry intermediaries that we have partnerships with, and grants that we've received. So we have at least a corporate level kind of oversight for all of the programs, but we rely on folks in the hospitals to really make these programs what they are. And those are the CEOs, the chief nurse officers, the HR directors, infection prevention control nurses, education coordinators, all of the kind of leadership roles within the hospital know about and connect with us regularly on these programs and help to support and make sure that they are what they have been, how successful they've been. So if you go to the next slide, I kind of have some examples here. This I pulled from last month's newsletter, and we collect feedback from apprentices as they go through the learning. And to me, this is immeasurable to share the impact that it's having on the individuals, because, it's kind of like, if you build it, or what is that? If you build it, they will come, or, that kind of saying that you build this and you hope that it has the impact that you want it to have. And this is just proof of that. This is specifically from our nurse assistants in that program. They're saying things like, the modules help a lot to make my job safe and easy. I mean, that's priceless right there. That is, a reason to do this. You don't need any other reasons, I don't think, than to be able to say that. Very thankful to work for this company, and I appreciate this opportunity to learn more about rehab hospitals. I gained a lot of knowledge because of this training. I found all this information very helpful to understand rehab better. All the modules are very helpful, should be offered to all CNAs. I love this course. Acquiring new knowledge is the best way to understand the patient, and informative. That's just one, a couple of bits of feedback that we've received. We have it built into our modules that the apprentices give us regular feedback, and they don't have to write anything in. It's one of those boxes that they can type if they want to, or they can just say, very much agree and move on. So, I mean, that's just an idea. It gives a vision of what the impact that we have seen of our clinicians, which is kind of what we hoped to have, is to give them a pat on the back and give them the recognition that they deserve for the good work that they're doing. Okay, you can go to the next one. And here's just a couple of pictures of some capstone projects that we've received. So these are posters from apprentices that have taken a topic. Sometimes these are topics that come from the learning itself, and they just have liked it enough that they want to share it or kind of take it a step further and say how it applies in their hospital. So these are from our Methodist Rehabilitation Hospital, which is in Dallas, Texas. But these are, you know, just two examples of things that we've seen across the country of capstone projects and the way that the apprentices are applying their knowledge back to their hospital and really having an impact on their peers. We've seen a lot of again, organic growth, where people in the hospital, employees in the hospital have seen these types of capstone projects and want to get involved. There's, you know, flyers that we have and information that we can share from the leadership to the employees so that they learn about programs like this and can take advantage of them if they want to. But I think that these capstone projects and sharing them from their own peers is one of the most impactful and best ways to actually share that information. So we would continue to have our capstone projects in all of the programs. We have, as you saw, we have programs for RNs. And in some cases, those capstone projects have been presentations or posters that folks have submitted to their professional association, which is ARN. So there's a lot of opportunity here to give back, not just to the hospital, but to the others in the field as well. And I think that might be my last slide. I can't remember. Yeah. So thank you all so much. We do have now, I know Madeline had said that we've got hospitals in the state, and we do. We have 2 Lifepoint hospitals in Vernal and in Price. And those are hospitals that we will be expanding the apprenticeship offerings to. That was a look at what the apprenticeship programs are currently for Lifepoint, but we plan to grow and make that have a bigger splash here in the Lifepoint family soon. So thanks so much.
Thank you very much, Laura. I'm going to stop sharing and we can move this over. Mandy and Jason, I'd ask if you could scoot in a little bit so that the people on Zoom can see you. And Laura, I guess I'll start with you. Can you give me an idea on how long it's took to get your apprenticeship program going?
Sure. So we started looking at apprenticeship as a model in 2019. So it took us a year. I would say within that year, we went from we started with what is apprenticeship and even what organization do we need to connect to learn more about this, which was the Department of Labor Office of Apprenticeship, which is where we started. And then we started connecting to, luckily, grant administrators like HCAP that had programs already in existence that helped us to really see what it could look like and educate us on how we could build a program to meet our needs. We were at first worried that we were going to be stuck with some, rigid framework that was not going to meet our needs. And quickly we learned that that is not the case. And first started working with grant administrators, then quickly soon after developed our own national standards that have been approved by the Department of Labor. So all of our programs now are approved by the Department of Labor, and we register apprentices under our own programs now. And we have applied for grants now on our own. I mean, the growth that we have experienced in the past 3 years, sometimes I wake up in the middle of the night and just shake my head thinking, oh my gosh, I can't even believe where we are now. It's just such it's a wonderful world. There's so much opportunity. We have connected to workforce groups through our grant intermediaries that have connected us to people in the communities that are looking for jobs like this. We've connected to different academic partners, but it was a huge learning curve for us that we learned about apprenticeship as a model that was being used in healthcare that's still, I don't think, widely being used in healthcare. So we're learning every day, but it took at least a year for us from the beginning planning stages to launch. And when we first launched, we just had 3 hospitals that we used as a pilot. And we had 6 apprentices that we enrolled. And we almost watched them for a year. I think it was a solid 6 months, 6 to 8 months that we just followed those apprentices and learned about the experience to find gaps or issues that would come up. There was a lot of HR steps that we had to kind of figure out as we went along. So before we fully ramped up to where we are now, easily 2 years.
Great, thanks, Laura. Mandy, same question.
I was thinking about how I would answer this question. So with Intermountain Healthcare, it's a really fascinating kind of journey that we've had to apprenticeship. And our clinical engineering program, I think, has been a number of months, probably 6 to 8 months lead time getting that one in play. Our medical assistant program that's down in Nevada, definitely a year in the making for that one as well. And that's been always under kind of tweak and evaluation. So similar to what Laura was saying, is that that one's been a work in progress, and now it's going to be come December. It's truly going to be a full apprenticeship program in the true sense of the model. I will say we have I was just chuckling because we have an intermediary multiverse that we've in conjunction with the one doing it. And that one was a 3-week lead time. And so I will say to anybody, that's a lot. That's not enough time. It was really a quick turnaround on that one, but we were able to make it happen through full support enterprise-wide and identifying really key individuals to help along the way to help that come to fruition. And then we do have an apprentice cybersecurity program, which has been in the works for a while as well, behavior, and just initiated in December. And so I think that year lead time is really appropriate. It can be done a little bit sooner, as we've found, but it really allows you to get all your kind of ducks in a row, all your T's crossed and I's dotted, and make sure that you're aligning with the correct individuals, the correct intermediaries. You're working with your state apprenticeship office, and really garnering the support to get these programs developed. So I think we kind of range a little bit from the Intermountain side, but that safe 1-year window really does help.
Thanks. Jason.
Like I said before, we're relatively new to this. We're in the business of higher education. So this world of apprenticeship, it's been brand new for all of us. And then, we really, came upon apprenticeships through this federal grant. And our grantor, this is a part of it. And but I gotta tell you, it still is a lot of learning on our own. And so we're working with Workforce Services, Office of Apprenticeship. When we looked at some other grantees at apprenticeships as well. So we were awarded, let's see, probably in about a year between the U.S. Department of Labor to get become a registered sponsored apprenticeship site, and we serve as an intermediary for a number of our agencies that we work with. And so right now we've got 12 apprenticeship sites. But we've got more apprenticeship sites than we do apprentices. And when I look at the number of apprentices, when I look at our program, we'll have our first cohort that's graduating at the end of this fall semester, so December of 2022, and expecting our first apprentices to go in January of 2023. So between putting together our work plan, it's a competency-based apprenticeship, the documentation, all the forms, working closely with our apprenticeship mentors, our community-based partners, about a year to 18 months.
Thanks. If anybody on Zoom has a question, you can either unmute yourself or put it in the chat. I'll be watching that. Does anybody in this room have questions for any of the panelists?
I have a question. I work in secondary ed, in current technical education. We have a number of health science programs, CNA and medical assistant and that kind of thing. How do those programs, given an apprenticeship model, how do those programs flow into or not an apprenticeship?
That's a good question. How, I would love to learn about your program that you have in place, because I think we really haven't,
Connected the dots.
yeah.
We're also.
Oh, you're all in the same boat there.
Well, no, we're K-12 ed. We're the
Okay.
Department of Ed. But I think that's that link from like CTE to the apprenticeship.
Yeah.
I don't think that exists well.
Okay, well, we need to make it exist then.
Yeah.
But make that, we've identified it.
Well, we have students, for instance, our CNA program, we have hundreds of students, I mean, not to overblow it, but several hundred students within my district alone, Granite School District, who come and do clinicals all over Intermountain, different sites and so forth. And I guess I'm just kind of scratching my head to say, well, okay, where do these students go if we're moving towards apprenticeship types of training programs? Is there a place for these students to flow naturally into
Into apprenticeship or into our system?
either or? Yeah.
Are they, when they finish your program, do they have their licensure already?
Yes.
So they don't really, I will say that our medical assistant program in particular, in Nevada, how it works is we recruit from underserved and financially disadvantaged communities. So we are directly going into those communities and recruiting individuals where we have identified the capacity and capabilities to truly kind of come into this profession and work in healthcare. So it's a really a good entry point for them working in healthcare. There are no background requirements needed to come into this apprenticeship. So it may function a little bit differently there than having students who are already licensed. So what we want to maybe identify is if you have a training program within your academic institution or your school district, and these students are already licensed, how can we get them into our facilities in that capacity to role right away? So how can we work together to convert them into the role that we're needing to fill, right?
And then this would be, I think, way outside of boxes. If we get them into the system as a CNA, then what if they want to go into an MA or an RN or some other kind of apprenticeship? Is there a way to say, we're going to take the experience that you've got as part of your high school experience and your licensure as a CNA, and then apply it to the requirements for this?
Yeah, absolutely. So that's really what we want to address with apprenticeship within our organization, and not only to recruit external candidates, but how can we upskill or develop new career pathways and ladders for internal candidates, right? So they come in and they maybe they come in, through a program similar to Laura, like through EBS, right? And then they say, oh, I want to start doing direct patient care. How can we use apprenticeship, develop their pathway and their career ladder? So then they can come into an MA apprenticeship or an OR tech, surg tech apprenticeship to get a new skill set, right? But then after that,
off work.
right,
in
so
order
they're
to do
coming
that,
in and
right?
they're working as an employee. Yeah, so they come into our program and they're an employee. So then we look at similar things. Okay, they've got a surg tech training. They want to become an RN. Well, there's a lot of overlap there already, right? So what do we do in that career pathway to build onto those current skill sets they've developed through apprenticeship so that they can start building the skill set needed to get into that new role? So we want to do it as upskilling internally, but then external in, we want to work on those pathways.
Let me ask you, do they receive concurrent enrollment for the classes that they're taking, clear notes, or?
For some,
Depends,
yes.
yes.
Yeah, it depends on the class. It also depends on the school district.
And I think there's an opportunity, and I know that the Utah system of higher education is all on board with apprenticeship. So I think you do bring up an excellent point as far as these gaps. I think this is something that we talk to Sony University president, senior vice president, to make this something we are going, non-credit education or even making this whole thing about, a pathway pathway to one, the workforce, but also higher ed as well. So I think that might, be an opportunity for us to pursue.
And I don't know how Utah is. I know some states are really pushing dual enrollment for high school students.
Yeah, we just opened it up huge.
I have my cousin in North Dakota, all 3 of her kids graduated from high school with associate degrees. And I know that there's some people that are starting an LPN apprenticeship in high school and getting all of their prerequisites done in high school so that when they graduate, they can then go on to an LPN program and become an LPN at 19, 20 and have a good career. So I think that there's a lot of things that can be done, when education and workforce truly partner. Yeah, I'll do one online, then I'm gonna get to you. Amanda asks, can I get some details on apprenticeships for mental health clinicians and admin support staff, including billers and coders?
I know that's coming through me, but I don't know of any mental health apprenticeship programs. So
Okay.
yeah, in the state of Utah.
Okay, I know that there are some apprenticeships with billers and coders with the AHIMA. Really sponsored some of those. If you had direct questions, you could reach out to me and I could find some resources and support for that. I know that there are a lot of entities looking at more apprenticeships for that front desk person because they have to deal with a lot. And actually, some of the folks I'm working with are incorporating behavioral health technician roles within the front desk person, because a lot of times it's the front desk person that really witnesses the person in crisis.
Mhm.
That's my second about
Yeah, I
building.
had- I had just received a question from the Urban Institute that is looking into building a medical secretary occupation. So it doesn't exist yet, but our MA program, which we're working on now, it hasn't launched, but our MA program has a clinical route and an administrative route, which kind of addresses that too. So I think it just depends on the healthcare, like on the hospital system that you're looking to get into. I think that this should become a point that all students should learn to ask about from employers, because there's so many different ways that this nut is cracked. And it sometimes depends on which organization you're looking at getting into. But there's opportunity and there's conversations that I know of that are happening at the federal level and to look at expanding occupations and programs, but haven't launched just yet.
A couple of comments and a couple of questions. My comments, I'm with Charter Apprenticeships and we have on Utah's EPPL right now, billing and coding, and we have medical administrative assistant already available. We're looking for industry partners for those. But I have a question for Laura, and it ties in a little bit with the question I have for you with your LPN program being in multiple states. But Laura, looking at Lifepoint, it's easier to identify the states you're not in than the states you are in. How was that with your CNA in migrating CNA with all of those nursing boards?
So our current CNA program is an advanced skill program. So we don't require them. We're not certifying them. We're not taking someone and putting them through a CNA program and getting them a certification. We're taking someone, so we kind of rely on our HR directors and our recruiters across the country to know within each state if they have to be certified, if they have to be a patient care tech or neither. And then when they're hired in, based on their eligibility, just, as you would normally go through an onboarding process and an interview process, then they're put into our nurse assistant program, which focuses on rehabilitation. I will say we are building a program right now that is, we plan to launch next year, that is to train folks to be CNAs, to put them through a CNA program to certify them. And for that, it is going to vary wildly between the states on what it'll look like for certification within each state, but it'll be an online program that they complete as like a cohort style is what we're thinking initially, and then they'll follow their state requirements and regulations. We initially wanted it to be that way when we first launched the program in June 2020, and quickly realized that the obstacles there to be nationwide were much too big, and they were prohibiting us from being able to launch. But then when we thought of it in a different way, and kind of just followed along as an opportunity for folks that differentiates us from competitors, because we're, competing against local job markets for pay. So we're looking obviously at our competitors, across the street and how much they're paying their CNAs, but then hopefully giving them through our apprentice program, not just those milestone pay increases, which can set us apart, but that extra handholding, which we have found is most important to the folks looking at jobs in our hospitals. They want a kind of transition to practice program that's going to give them mentorship beyond orientation. So.
And a similar question with your LPN program.
We have an MA program, maybe that was.
I thought I saw LPN on your.
Yeah.
We have LPN.
Oh, you have LPN.
Yeah.
Okay, so LPN is the same thing. They're already an LPN and they enhance their skill set.
Correct. And so we have certifications or competency checkoffs in-house on skills that all hospitals are doing anyway. Most of our hospitals are in-house checking off LPNs on skills like phlebotomy, for example, so that they can perform those functions in patients without, they haven't gone through a phlebotomy program, but through our in-house competency skill checkoffs with our nurse managers and our CNOs, they're able to perform those skills. And so our LPN LVN program has online learning, this particular to rehabilitation, that they complete the same learning that the rehab RNs go through the Association of Rehab Nursing. But in addition to that, they have competency skills that they have to complete. There's at least 5 of them that they have to work with their managers to be checked off on, so that all LPNs, LVNs across the country can perform these functions, because we want them to be able to do what they can, everything that they can, so that the RNs aren't performing those skills. Obviously with staffing shortages, that's not a perfect world. Everyone is doing what they can, but that's the idea with our LPN LVN program.
Thank you. You had a question?
Yeah, so I am just curious from the business side, what does the retention of your apprentices look like? Do they remain long-term, or have you ever seen like a loss in one specific area where we're losing apprentices for even after they finish the program? What does that look like?
I might default to Laura to answer that. We just finished our very first cohort of MA apprentices. And so we have them all after 3 months. One thing I've really been trying to look at too, and I've asked for some metrics and data from our state office, is to say, we can kind of show apprenticeship retention rate 1 year out of their program, but what does it look like 5 years out or 10 years out, right? Even if it's in other industries, like more trades or that type of thing. That's what I would love to see. And Laura might have some better metrics, given that they have a little bit more longevity in that, but I would love to hear that answer as well.
Yeah, we would like to as well. I think we're building a long-term data analysis project that we could use, but currently we have 80% retention of the staff that are in apprentice programs, which is just, that's amazing. When you look at, in some cases, turnover is, we kind of measure turnover as a 90-day mark. When an employee makes it to the 90-day mark, that's a typical cutoff, then quarterly throughout the year. So if they can make it each quarter, 90 days, then that's a success. And I think our largest turnover right now is probably the same as everybody else. It's in RN and CNA. And to have an 80% retention of employees that are in the apprentice programs is significant, is a huge success. That's something we hoped to have, but the largest number of apprentices we have in our programs are CNAs. I would think if you broke it down and looked by occupation, RN would have the highest retention. And those are, I think that's because of the nature of that beast, that those RNs have chosen to be in the program because they are on the path to get their CRN certification. And having an employer that not only gives them the time during their shift to study and prepare for that exam, but the tools and resources to do so. That was a barrier for our RNs that we learned before we launched that program to even wanting to get their CRRN, which is a national benchmark of quality care and rehab excellence, is to get their CRRN certification. So we have, you know, an industry-wide goal of increasing the number of RNs that have that certification. So they have a lot of skin in the game there to really join that program and engage with it fully. So there's differences occupation to occupation, but overall, we see a pretty significant retention among employees in the programs.
What's a typical retention for a CNA or an RN? You said 80% of your apprenticeships, but what's like general population?
Oh, it's turnover in the 100%. I mean, it's high turnover. It's not uncommon for a CNA to join, and as you know, in our settings, someone who isn't necessarily understanding what they're getting into with rehab, they join and leave within the same day. They see it's a really tough market because they can work just about anywhere else and make more money, and the job isn't as difficult. It takes a special person that wants to be in that role in the rehab hospital in particular. So turnover among CNAs is high enough that it is causing staffing shortages, which causes patient census shortages, which impacts business. So it's our highest focus point right now is on RNs and CNAs among any other occupation for that reason.
One thing we're trying to address through the medical assistant is that type of thing as well. So when we think about apprenticeship, we are truly training them on the job. So they are really aware of what the job demands of them, what it entails. And so in our medical assistant program, they go through 90 days of didactic education first before they enter the workforce. They then enter the workforce for another 7 months doing clinical rotations. Those are 11 separate clinical rotations. They're really getting a true view of the entire scope of their practice, so that when they get into the field, it's not overwhelming. I think a lot of these CNAs, MAs, that type of role, they get into the job on day one and they think that is complete overwhelm, right? Whereas if we're training them day by day, and it's an introduction day by day, this is what you're experiencing, when they get into that clinical phase, it's not so overwhelming. So they're really put for that job, and that's what we want to, measure those statistics. So we want to measure retention rates. But the other thing we also want to do as a system is start measuring promotion rates for apprentices. So when we think about career pathways and career ladders, they may come in as an MA, but where does that lead them? Are they going to that MA2 role, MA3, more advanced senior MA role? Are they moving to an RN role? Are they moving to somewhere else within the organization? Are they moving to an administrative role? So we also want to track promotion as well for apprentices and really watch what the apprenticeship model is doing internally to grow employees, but also to train them appropriately for the job.
Thank you. We have about 5 minutes left. If each of you could give a quick minute talking about what advice would you give to somebody who's looking to start a registered apprenticeship program? Jason, would you like to start?
I would certainly look to identify who are partners, who are other persons that are already doing apprenticeships, who are agencies that are doing apprenticeships. And it's interesting when we talk around behavioral health, and again, they were talking earlier, to understand, the market out there. So when we look at behavioral health, when we want to look at phlebotomy, dentistry, nursing, I know that we're talking about the healthcare industry, but I think it really is, educating and informing that this is the apprenticeship piece. So again, identifying, who are agencies, executive directors that are committed and are aware of apprenticeship opportunities and the value and benefit that it can have to their respective agency and organization.
Thank you. Laura.
I would say if you're able to have dedicated staff to focus their time on this solely. I know that's a big obstacle. That's one I talk to a lot of folks that are interested to know how to get started. That is the thing that I talk about the most. We were lucky on our team to be able to shift priorities and responsibilities. And that is what I have totally focused on 100% now for the past 3.5 years. And we hired a new staff member that solely supports apprentice programs. So I think that's what it takes to be successful, is at least it's a team of one or maybe more that can focus their time completely on making this work.
Thank you. And Mandy.
Yeah, I would echo everything that Jason and Laura say, have said. And additionally, identify why you're using apprenticeship within your own organization, address where your needs are, why they're there. And I think that will allow you to have longevity, but also success in your program. So we've identified a few key initiatives and strategies in which we will use the apprenticeship. And our goal is then to do something in conjunction with that to give us the stuff.
Great, thank you. I appreciate your time today. I think we're meeting back at the big room at 10:45. And Laura, if you could stay on for a minute, I'm going to try and get a picture of you all. I don't know if it'll work. Thank you all. And obviously, if you have questions for any of us, we will be available. Thanks.